Hi there, Jim Engelman with the Rotary Club of Land O'Lakes, and with me is Dr. Eric Musiek. Dr. Musiek, you had the opportunity to talk to the group here of Rotary at our district conference, and you were talking a lot about Alzheimer's. If you were to sum it up in just a couple of sentences, where are we in the progression of treatment of Alzheimer's?
Well, as many people have probably seen in the news, there's been some very notable failures of some drugs recently, and so that's forced us to kind of go back to really considering the role of the amyloid beta protein in the disease. And it looks as though we may be treating too late in the disease process to really be effective with these amyloid-based therapies. So these plaques, we think, occur 15 or 20 years prior to the onset of the disease. And it looks from the data so far that the drugs, even though they are effective in lowering amyloid levels, that if we treat people that already have symptoms of the disease, that may be too late. So there are a number of trials now where we're trying to treat people pre-symptomatically. Much as though you would lower someone's cholesterol to prevent them from having a heart attack, perhaps we can lower amyloid before people get Alzheimer's disease and they won't get the disease. At least that's one of the thoughts. There's also a big push to work on other targets other than amyloid beta. So the tau protein that forms the tangles in the brain, a lot of different groups are trying to target that now because we think that may really be sort of the executioner in this disease and cause a lot of the destruction in the brain.
You know, there's a lot of research that still needs to be done. If you were to sum it up in the top 2 or 3 things that most people can do today to help decrease our opportunity to have Alzheimer's disease in the future, what would those be?
I think exercise is probably number 1. Controlling cardiovascular risk factors, so if you have high blood pressure, high cholesterol, or diabetes, keeping those under control. There's some ties between sleep and circadian rhythms and Alzheimer's, so if you can get good sleep and have a regular schedule each day, that's probably important. And keeping your brain active, so keeping engaged. The more you use your brain, the lower your risk of Alzheimer's disease.
Well, there's a lot for all of us to think about. Thank you so much for being here today. We really appreciate your time and your efforts, and we appreciate everybody that's watching this program. We hope you got a lot out of it.